Hi everybody, welcome to our second talk on neoplasia. Let us get right in. Here in this table there is a comparison between the characteristic of benign and malignant neoplasm, like speed of growth, invasion, metastasis, and differentiation. Also the comparison between nomenclature between the two, benign and malignant, and the clinical effect on the affected person. Let us start by, as you see here, benign tumor. Here this is a benign tumor. So you find that the benign tumor are slowly growing, unlike that of malignant tumor, which is rapidly growing. Also, benign tumor are regular in their surfaces and capsulated. If this is a tumor, you will find it regular and there is some sort of capsule. While that of malignant, you will find it irregular like this and non-capsulated. So can be attached to the deep structure, unlike that of benign one, which is not attached to the deep structure. Furthermore, we have invasion. As you see, that benign tumor cannot invade the other organ. Unlike that of malignant tumor, they have the characteristic of invading other organs. Moreover, spread and metastasis of the cancer. Here in malignancy, there is spread and metastasis to remote areas, unlike that of benign tumor, which is only localized and fixed to the, in their site of origin. Moreover, as you see here, there is well differentiated. For benign tumor will be well differentiated, while that of malignant, you will find them more poorly differentiated. Sometimes might be moderately differentiated or well differentiated, but well differentiation is a feature of benign tumor rather than malignant tumor, as you see here in the table. Moreover, we have recurrence in malignancy. You will find that there is recurrence after surgery, unlike of that of benign, which is not recurrent after surgery. Moreover, there is some sort of bleeding generally in the tumor, inside the tumor or after surgery in malignancy. Unlike that of benign, you will not find this feature of bleeding. Moreover, in the nomenclature of benign tumor, you will add only the suffix oma, only at the end of the name of the tissue or the cell. Unlike that of malignancy, you need further. For example, you need to add the suffix sarcoma or carcinoma according to the origin. We will talk about this point later on. But you have to put at the back of your mind, sometimes there is some sort of, exceptional rule for this point. The last point, which I will talk about it, just what is the effect of benign tumor on the tissues around it. There is some sort of slight pressure, unlike that of malignant tumor, which is there is remarkable pressure on the affected neighboring tissues and organ. Now we will go over etiology of neoplasm. But the most important thing you have to know that neoplasm to take place, we need more than one hit, like genetic hit, environmental hit, and biological hit. The most important one is the genetic hit. So tumor formation is a multifactorial and multi-step process. Let us start by the first one here, the genetic factor. Genetic factor means that there is some sort of damage in the DNA which result in, for example, mutation in Protooncogene, cancer suppressor gene, apoptotic gene, and DNA repair genes. So these are the genes which are controlling the formation of neoplasm. Let us go over them one by one. Protooncogene. What is protooncogene? Protooncogene actually are found normally in our body, and they produce the growth factor in our body normally. But when mutated, they get crazy, giving what is called neoplasm. So what is protooncogene? Protooncogene are some sort of genes that are producing growth factor in normal body, normal individual, but when activated, it will be called oncogene. So protooncogene is the primary one, and oncogene are the active one. So when activated, when giving this substances, or gene, which is called oncogene, they will give or produce neoplasm. Let us take one example here, of protooncogene, which is called RAS oncogene. Actually, RAS oncogene normally found in our body, and when it get mutated, it will give neoplasm, as I have said before. And actually, this type of oncogene is found in more than 20% of all cancer in our bodies. Okay, in human, bodies. So normally RAS is activated by GTB change to GDB. So there is some sort of mutation here in this point, which is give mutated protooncogene here, RAS. So the result of that is a proliferation of cells and giving neoplasm. The second gene in formation of neoplasm is a tumor suppressor gene, as you see here in this slide, which is some sort of gene that is stopping the cancer. So absent of this gene will result in cancer. So the cancer will find its way in the cases when there is absence of this or lacking of this gene. So what is cancer suppressor gene? It is some sort of genes that prevent cancer formation. Absent of it will result in such a formation of, cancer or neoplasm generally, whether cancer or benign one. Let us go over one example. It is a retinoblastoma gene, which is firstly recognized in a tumor of pediatric age, which is called retinoblastoma. This tumor starts in the retina. So you will find this abnormal mutated gene in this type of cancer, and also in other cancer, but its name come after this one, retinoblastoma tumor. So retinoblastoma, actually it is a gene that is controlling the cell cycle. Mainly the phosphoproteins in the cell cycle. So when it is absent, most probably there is some sort of overgrowth. The cell will be proliferated more and more without stopping. Now the remainder two genes are preventing genes. That is to say, lack of them will result in neoplasm or tumor formation. And these genes are called apoptotic gene and DNA repair gene. Let's start by the first one, apoptotic gene. Actually, this means that this gene is responsible for apoptosis. So apoptosis sometimes is very important to prevent our body from accumulating a lot of cells, that is to say, proliferation. So when these apoptotic genes are absent, we will expect that the tumor will be formed because of there is a overgrowth or a lot of formation of cells. An example of this apoptotic gene, we have breast cancer gene 1 and breast cancer gene 2 is called PRCA1 and PRCA2. Also, we have another very important gene which is called TP53 and BCL2. This is in B here stands for B cell lymphoma. The other gene, here DNA repair gene, from its name that this gene is responsible for repairing any error in the DNA synthesis. So when it's absent or it's mutated, the result of that is no repairing for this error, so most probably tumor will be formed. Let us take one example for this DNA repair gene. It's called match repair system. This type of defect is found in colorectal cancer. Here we will go over some neoplasm related gene and their code. Let us start by the first one. This is not all of them, but these are the very important one and maybe a little bit difficult, so I will go over them. Like the first one here, APC, it is adenomatous polyposis coli gene, and this gene is found in colorectal cancer. Also we have HER2, it's called HER2, for example. Human epidermal growth factor receptor gene comes from here, the name. Also we have RAS gene, which is related to rat sarcoma virus gene. Also we have another code called DDC gene, which comes from DOPA decarboxylase gene. And another one is called CIS, which is related to simian sarcoma virus. Also we have BRCA 1 and 2. This is breast cancer gene 1 and 2. Also we have APL, which is related to Apelson Protooncogene or PCR APL. It's called like this. And we have PCR. PCR stands for break cluster region. We'll go over it later in hematology. Also we have another very important genes like RAF gene or PRAF gene, which is related to rapidly accelerated fibrosarcoma. These are some of the name of or code for the genes that we will go over them maybe in our lecture or later on. Now let us go over the most important oncogene, as you see here in the first column, and tumor suppressor gene in the other column. Like first of all here we have APL gene, which is found in chronic myeloid leukemia and other type of hematological leukemia called lymphoblastic leukemia. Also we have another gene called BRAF, which is found in melanoma. HER1 found in squamous cell carcinoma of the lung. HER2 found in breast carcinoma and ovarian cancer. We have another gene called MYC gene, which is found in neuroblastoma gene and small lung cancer. We have RAS with other subvariant of RAS found in lung carcinoma and colorectal cancer also. KRAS is a subtype of RAS in pancreatic carcinoma and renal cell carcinoma. HRAS found in bladder cancer. Another gene called CIS, this is oncogene, found in astrocytoma and osteosarcoma. Another oncogene called tissue factor A, found in astrocytoma and hepatocellular carcinoma. While for tumor suppressor gene, we have APC gene, which is have different subtypes. For example, beta-catenin, found in stomach carcinoma and colorectal cancer, pancreatic cancer, also found in familial adenomatous polyposis coli. PARACA1 or breast cancer 1 gene, found in breast cancer and ovarian cancer, and also PRCA2. Another gene found in colorectal cancer is called DCC. Also, we have another gene. Here we mean by gene, we mean tumor suppressor gene, neurofibromatosis 1, found in neurofibromatosis and in other type of malignancies like sarcoma and neuroblastoma. Also, we have retinoblastoma gene or tumor suppressor gene, that is to say retinoblastoma, and in osteosarcoma and other cancers also. We have another tumor suppressor gene, this is very well known, called TP53, found in most of the cancer in our bodies. And maybe lastly, or the one before the last one, we have von Hippel-Lindau gene, which is found in von Hippel-Lindau syndrome and renal cell carcinoma. Lastly, but not least, we have Wilms tumor 1, Wilms tumor 2. Both of them are found in Wilms tumor. Okay, now we will discuss the hereditary factor in cancer formation. As we have said before, that some cancer are inherited as Mendelian pattern, and some of them are non-Mendelian pattern. Here we have, for example, familial adenomatous polyposis coli and retinoblastoma and neurofibromatosis. All of these are inherited as autosomal dominant, while other have non-specific type of inheritance like breast carcinoma and ovarian cancer and some other types of colorectal cancer. Not all of them are present as a non-Mendelian pattern. Here is a continuation of etiology of neoplasm. We have oncogenic viruses, and these are unique viruses that can insert a new gene in the human DNA. Oncogenic viruses. Oncogenic viruses are specific viruses that contain APL, MYC, or RAS, or any other types of oncogenes. And actually, these RAS or MYC can be transmitted to the human genome and inserted just near a normal oncogene of human body. So when a viral oncogene is inserted near proto-human proto-oncogene, they will activate each other. Mainly the viral oncogene will activate the human one. And what is the result of that activation? Amplifying them and increasing their activity and overexpression of the protein that is produced by this proto-oncogene, and the result of that is neoplasm. Now these are examples of oncogenic viruses. Number one, we have human T leukemia lymphoma virus type 1 and 2, TLV 1 and 2. These types of virus can cause lymphoma or leukemia in adults. Also, we have human papilloma virus HPV, causing benign squamous cell papilloma of the skin and carcinoma of the cervix. Also, we have Epstein-Barr virus EBV, causing Burkitt's lymphoma, well known, and Hodgkin disease, and nasopharyngeal carcinoma. Moreover, we have hepatitis B virus and hepatitis C. Both of them can result in liver carcinoma. These are the most important viruses, but oncogenic viruses, but still we have more. For continuation of our talk about the etiological agent of neoplasm, we have carcinogens, which are chemical or physical or natural agent who can result in cancer. What is carcinogens? As you see here, these are substances which may play a big role in tumor formation, and it can be classified into chemical, physical, and naturally occurring carcinogens. Let's start by the chemical carcinogens. As you see here, we have drugs like alkylating agent. These are anti-cancer drugs like cyclophosphamide, chloramphenicol, busulfan, melphalan, and others. These can result in new neoplasm formation in the patient who are taking it. Also, we have nitrosamine, anamine, and azo dyes, which are found in preserved food, may result in GIT cancers like gastric carcinoma and so on. Also, we have smoking. As you know, that smoking is associated with lung cancer, bladder cancer, and renal cell carcinoma. But we will talk about the smoking and its relation with these, cancers later on in another video. Different radiation are considered as carcinogens, like ultraviolet light, which destroy the skin coming from the sun, also result in skin cancer. Also ionizing radiation, X-ray radiation, and atomic radiation, and this is very important, especially atomic radiation, nuclear bomb, which is take place in Hiroshima and Nagasaki in Japan, if you remember, result in a lot of and different variety of cancers. Also, nuclear explosion in Chernobyl in Ukraine, if you remember, also produced a variety of malignancies, especially leukemia and lymphoma. Finally, we have naturally occurring carcinogens and miscellaneous agents which can result in cancer. And for naturally occurring carcinogens, we have aflatoxins, which is found in the ground nuts, which result in hepatic carcinoma in some African countries like Sudan and Darfur. Those who are eating ground nuts a lot of time, sometimes they may develop, or this, ground nuts may develop some sort of toxins within it. And the result of that is hepatic carcinoma. Also, we have another, miscellaneous agents like asbestos and arsenic. Both of them may result in different type of cancer. Asbestos, for example, may end up with bronchogenic carcinoma or mesothelioma, while arsenic may result in skin cancers. Now here is the pre-malignant lesion. What are the pre-malignant lesions? These are potentially malignant lesions which can be transformed into malignancy, like chronic skin ulcers, margarine ulcer, which is found in the skin, may be transformed into squamous cell carcinoma. Also, chronic gastritis may be transformed into gastric carcinoma. Liver cirrhosis due to different viral infection, or maybe alcohol or any other cause, may be transformed into hepatic carcinoma. Moreover, ulcerative colitis may be transformed into colorectal cancer. Leukoplakia in the oral cavity may be transformed into squamous cell carcinoma. And different type of dysplasia in the body may be also transformed, is considered as pre-malignant lesions. Now we will finish our talk about the etiological factor of neoplasm by taking some, revision for this risk factor of specific malignancies, or neoplasm generally. First of all, we have risk factor for pancreatic tumor. We have tobacco smoking, obesity. While gastric carcinoma and gastric neoplasm, we have dietary nitrates, alcohol, tobacco, Helicobacter pylori. All of these are considered as risk factor. And then after that, we have liver tumor, also associated with hepatitis B and C, liver cirrhosis for any cause, hemochromatosis. This is accumulation of iron in the liver, aflatoxins found in the ground nuts. Colorectal cancer, risk factor are hereditary syndromes, different hereditary syndromes, and inflammatory bowel disease, obesity. Then what about renal? Renal risk factor for cancer like tobacco, smoking, obesity, and hypertension. What about bladder cancer or bladder neoplasm? We have tobacco still, and occupational exposure for those who are working in the rubber, plastic, and aromatic amine, and stuff like that. Then what about breast? Risk factor for breast carcinoma, early menarche, late menopause, nulliparity, BRCA mutation, breast carcinoma gene 1 and 2, stuff like that. What about prostate cancer? Prostate cancer, we have increasing age, African origin. All of these are risk factor for prostate.